Hello, my name is Crystal Hernandez, and I will be conducting a infant 2-month-old well checkup, alongside with the baby and mom. Alright. I am conducting a 2-month well child visit. Mom, on a 2-month-old female who was 40-week gestation, no complications, no gestational diabetes or anything of that sort. Spontaneous vaginal delivery, no history of jaundice or any medical history thus far. And per the mom, she is wearing 6 diapers a day and having 3 stools a day. Mom is breastfeeding, so she's breastfeeding 4 ounces 5 to 6 times a day. Okay, baby sleeping well through the night. There is no sign of symptoms of distress or anything that mom is particularly concerned about. Okay. Alrighty, so the first thing I'm gonna go ahead and look at the baby. I see that the skin is nice and pink. I don't see any signs of jaundice. I don't see any bruising or any masses or lumps to the head, to the chest, and to the legs. I also see that she's awake. She is not crying. She is calm, and she is eyes are open. She's looking around, and she is moving her head as I move around and following and so forth. Okay, she is warm to the touch. Alright, vital signs show that her temperature was 98.0, heart rate was 140, blood pressure was 80/50, and she doesn't look like she's in any pain. She hasn't been in any distress, no nasal flaring, no intercostal retractions or abdominal retractions either. And her O2 saturation was at 99% on room air. Okay. First off, I will go ahead and start inspecting her head. I will be measuring her head circumference, as well as checking the frontier and the interior and the posterior fontanelles. Okay. Alright. I will first assess the head. I can feel the interior fontanelle. It is not severely pitted and it's not protruding outward either. I can feel the posterior fontanelle. It is not protruding nor pitting or indenting profusely as well. I don't feel any masses on the scalp. I don't see any lesions or any openings to the scalp either, or bulging. Okay, it is nice and soft. I can feel the sutures. Alright. I'm gonna go ahead and measure her head. Alrighty, her head is at 38 centimeters. Alrighty, now I'm gonna go ahead and see her face. I don't see any lacrimal discharge. Both eyes are symmetrical. I don't see any signs of ptosis or anything of that sort. Eyebrow furrows are present. Okay. Alright, I don't see her nose. I don't see any septal deviations, and I also don't see any occlusions to the nerves, so they are nice and patent. There are no fissures or open wounds. She does not have a cleft lip, and no dimples or any masses either. Okay, now I will see her ears. Her ears are midline to the sides of her eye. There are no skin tags. There are also no pitting to the ears. Toward the pinnas are nice and intact, and there's no open lesions to the ears, nor obstruction to the ear canals, or no drainage as well. Okay. Palpebral fissures are not swollen, they're straight. Now I'm going to go ahead and be checking for that red reflex. Red reflex is present. Okay, perfect. The red reflex is present. Aside from that, I'm going to go ahead and now look at her jaw. I don't feel any swelling, nor on her lymph node here. Okay. I'm gonna go ahead and put my gloves on. I'm gonna go ahead and checking her mouth and her suck, and I'm gonna be assessing her hard palate as well. I don't feel any fissures to the hard palate. Everything feels moist and intact and warm. Baby is sucking on. Okay, I'm gonna go ahead and open her mouth. I'm gonna have her elevate her tongue. There are no presence of tongue ties because her tongue elevates past her bottom jaw and gums. Okay, good. For most story, baby latches on to her breast well and does not have any difficulty breastfeeding. No history of colics either, or reflux or spit up. Okay. Alrighty. I'm gonna go ahead and check her neck. I don't see any additional tissue or any webbing to the neck. I'm gonna go ahead and check her clavicles. They are nice and smooth. I do not feel any fissures or any lumps or bumps, which is good. Alright, her chest is flat. There is no distension. And I will go ahead and listen to her lungs at the APCs and at the bases. I don't hear any wheezes or adventition sounds. I'm going to go ahead and see her abdomen. I see it's nice and flat. I'm going to go ahead and also take her abdomen. Bowel cells are present. I'm going to go ahead and palpate. Liver's not enlarged. It's in within the costal margins. Okay, the baby doesn't seem to be bothered by pressure, so no pain. And I also felt no masses or bumps to the abdomen. Okay. Right now I'm going to go ahead and check on her groin. I'm going to see her diaper. She doesn't have a wet diaper, but I will be checking her groin and her femoral pulses. Okay, they're present. I'm also going to be checking her hips. Okay. So I'm going to be checking for hips dysplasia, following Barlow's method. I'm going to go ahead and adduct, put pressure to the 90 degrees, and out, adduct, and no clumping or clicking or anything of that sort. Baby does not seem to be bothered by that either. Does not seem any distress or pain. Alright, again to the other side. I'm going to go ahead and adduct, put pressure to the 90-degree angle, and then I'm going to go ahead and adduct and bring it back. No pain. Perfect. So there's no signs of hip dysplasia present. Alright, I'm going to go ahead and see her toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3. So 10 digits. There is no additional digits and no other missing digits either or extremities. I'm gonna go ahead and turn the baby to her back. Okay. I do see a couple of gray blue spots. That is normal. Okay. I do not see any dimpling. Okay. No dimpling to the back. Okay. I'm gonna go ahead and also listen to her back, to her bases. And bring the baby back down gently. Okay. No wheezes or adventition sounds either. Okay, I'm checking her spine. Right. Okay, no sacral dimpling. Alright, I'm going to go ahead and go back to the groin, and I'm going to be checking her genitals. Her vagina, her labia is a little swollen due to the hormone fluctuation. I don't see any discharge, and I'm going to go ahead and check the anus as well. Okay, it is all patent. I don't see any disturbances. Alright. Okay. So so the baby is awake. She is consolable. She is not crying. She is comfortable. And I am going to go ahead and pull her arms up and do the more reflex. Okay, I'm going to have her come up. Her head is coming up with me, and as I bring her down, she extends her arms and brings them back in, and she seems to be comfortable. Okay. Alright, I'm going to go ahead and put my finger on her palm. Okay, she is grasping it. Okay. And then I'm going to go ahead and also be checking on her side, on her attention, her sensation on her cheek, and baby is cooing and sucking on her lips and looking towards me. Other side. Okay. Okay. And then I will be also checking her heart as well. The aortic, pulmonic, tricuspid, and mitral. S1 and S2 is present, no other clicks or gallops or murmurs are present. Overall, the baby is doing well. She is not in any distress. She's well developed for her 2-month age. The only thing that she will be receiving today is vaccinations. She will be getting the Hep B, the DTaP, the HIV, and the polio vaccination. Mother or mom with these vaccines, she may or may not experience a little fever. She may be in some discomfort. So Tylenol based on her heart weight will give you the sheet to kind of follow, or warm baths to kind of help with any temperature or fever. Nonetheless, we'll see her back in 2 months to follow up on her second or her next child blood check. But other than that, she's doing well. Make sure that she's feeding, wetting diapers. If for whatever reason you feel that she's not wetting diapers, either 5 to 6 a day, please bring her back so we can reevaluate. Or if you feel like something is off, that where she's not eating or not passing enough stool, or you feel like she's too distended or too colicky, please bring her back so we can further evaluate. And that concludes today's examination.